We believe that by preparing for accreditation, we will better be able to show outcomes for the programs and services that we have. We feel we'll be a more credible organization and very much accountable, and it'll be clear to the public and to policymakers and others in the public health system that being accountable is important to us.
I have been a member of the NALBO Board of Directors since about 2002, so I knew of this process that was going on, and NALBO certainly was on board. So as a person who worked at the national level with public policy, it was just natural for me to come back to the local health department and say this is a really good thing. And of course we have a health officer who's very interested in quality improvement and doing our job as cost effectively and as the best we can be.
Accreditation is great. It's a way of demonstrating accountability to our elected officials, to our community, and to ourselves. And it's going to provide us with the opportunity to look at the programs that we offer, identify our strengths, and identify our areas of improvement.
We want very much to ramp up our quality improvement. We want to show the taxpayers that what we do in our health department really does improve their quality of health. And then communicating that to folks for increased accountability. We felt that it was very important as a health department to pursue accreditation.
We also know that our resources continue to shrink, and we need to be sure that we are using those resources wisely. So to assure that we are implementing evidence-based programs and that we're engaged in continuous quality improvement and performance management, we know by doing all of that we ought to have good outcomes and in the end improve the public's health. So that ultimately is our goal. We also anticipate in the future that funders will give preference to agencies who are accredited, and so it's important that we position ourselves in a way where we have the best access to the resources we need to continue doing the good work that we do here. And we ultimately want to better show that what we're doing is effective, that we have outcomes, that we can describe our value to the public and to policymakers. And so that's why it's very important to us to prepare for accreditation, ultimately become accredited.